Good afternoon, everybody, and welcome on Tunis International Radio. You are listening right now to the daily edition of English language program presented by Huda Ben Sheikh in Studio 1 with my colleague Ghaythous Latif for the technical engineering. We are happy to have him back, our great technician and great friend of RTCI and all of us, the team of RTCI. So today we are going to speak about an interesting congress, a national congress that has been organized recently in Hammamet, and it is more specifically about geriatrics and gerontology. I was really curious to learn a little bit more about it, and I would like to thank the Tunisian Association for Geriatrics and Gerontology, the STGG, for this interesting congress, because we are going to learn a little bit about what is the specialty and what are actually the main activities of these specialists. It's a kind of a new specialty, if we can say. I would like to thank my guest over the phone, Dr. Imen Ksontini, who is going to tell us a little bit more about it. Hi, doctor. How are you?
Thank you. Hi. Good afternoon, Huda, and good afternoon, dear listeners.
Thank you for accepting the invitation, doctor. We know that you are busy right now, especially after
yes,
the Congress.
I would like to be with you, but unfortunately, it wasn't possible for me.
Yeah, we know. We can understand you. It's busy time and hectic time, especially that you are in direct contact with the elderly and old people. So you are managing, I suppose, the list of patients waiting for you. So concerning this specialty, can you tell us a little bit more about it? What is a geriatrics, doctor, and how difficult it is for you to practice this job? And first, please, is it a new specialty that has been going on for, I suppose, for a couple of years? It's not that old as a specialty.
Yes, geriatric is a medical specialty that focuses on the care of older people. Mm-hmm. It's not a new specialty because all around the world, the geriatric is a specialty from many years now, about 20 years, like something like this.
Mm-hmm. And in Tunisia too.
Yeah, in Tunisia, we have not a specialty. We have a competence in geriatrics. And recently, with the Minister of Health, the minister decided that geriatric will be a specialty in the near future.
Yeah, in December, actually.
In December, when the students will pass the exam of the residana, they will have the choice to choose geriatric as a specialty, like they choose cardiology or ophthalmology or other things.
Okay, so that's really great opportunity to transmit your knowledge and experience to other young doctors. So what does it consist in, this specialty, and tell us how it is for you to take care of the elderly?
Yes, the geriatrician is a doctor who treats, who monitors, who supports elderly patients. Mm-hmm. And as you can imagine, working in this field is not easy. Mm-hmm. This is due to many factors, because elderly people have comorbidities, many pathologies, polypharmacy, they took many medications, and had especially psychological problems. Mm-hmm. So that, faced with this challenge, doctors encounter significant difficulties in their daily practice. Mm-hmm. Usually, it is difficult to take care, to support, to follow this category of people, but we try to do the best.
Okay, so and that's what I was curious about, I suppose. So geriatrics as doctors here, they have to know a little bit about psychology, sociology, about the general medication also, because those who come to you, they are not only old, but many of them are having beginning of Alzheimer's, so they cannot communicate very well. Others probably they are having lots of medications related to diabetes or cardiology problems. So how is it easy for you to communicate and to interact with them?
Usually we have the possibility to communicate with with the patient or with the family. For Alzheimer's disease, for example, we communicate with the family, the sons, the daughters, and the person who accompanied the patient, and we try to explain the situation, the medication, the follow-up, how to treat, how to take care. We have this. You must have many patients, and you must take enough time. You mustn't be speed in geriatric exercise. It takes many time to do the job well, like you want.
Exactly, I suppose so. You need to take your time and get close to the patient himself so that he can be confident in you and he can tell you about all their difficulties.
Yes.
Okay, so what about the STGG, which is the Tunisian Society of Geriatrics and Gerontology? So what are the main activities of this association, and what are the main events that you organize?
Yes, the Tunisian Society of Geriatric and Gérontologie is a medical association which was created in December 2021. The aim of this society is to promote and to develop geriatrics in Tunisia. And during these 4 years now, we organized many events, including congresses, meetings, master classes. For example, 2 of which of master classes were held last year, which focused on oncology and neuropsychiatry in elderly people. We do many medical appointments with the different doctors to promote and to develop this specialty.
Exactly. So I was curious, I mean, here, is there any exchange that happens between Tunisian doctors and foreign doctors? Do you organize international seminars or international master classes?
Yes, exactly. For the master class of oncology, which was held in the University of the Faculty of Medicine of Tunis, we have foreign doctors from France who gave us lectures in distance, and also for the master class of the neuropsychiatric, we have the chance to have one geriatric doctor who came from also France, and he was here, and he spent the weekend with different lectures and his experience, and we changed together about this.
Exactly. I suppose that this exchange is going to be very fruitful for Tunisian doctors to see how, foreign doctors being French, Italian or Spanish or whatever, the exchange is going to be very fruitful for you because you can learn from other people's experience.
Exactly. Because they have also the experience of geriatric since many years now. So they are more advanced in this field. If we compare with the situation in Tunisia.
Exactly, I suppose so. So very recently, here last week or last weekend, you organized a very interesting congress. It's a national congress about geriatrics and gerontology. And there is a very important theme that you have been discussing about, which is pain. And the theme was actually movement is the source of life. And there were many panels, and the panels were debating about the pain and how to treat pain, I suppose.
Yes, last weekend, exactly, was held the first Congress of the STGG in Hammamet. And the main topics discussed in the panels included cardiology, not only pain, but we discussed about cardiology, about neuropsychiatry, about oncology, and about nutrition. We focused on nutrition in this Congress. But besides the panels, we have also workshops. 6 workshops were also offered covering a variety of very interesting subjects. And in this Congress, we invited the foreign speakers from France, and we have also our own speakers here from Tunisia, a group of Tunisian experts, and we changed together for these subjects.
Okay, so that's really great. You highlighted nutrition. Is there any important aspect about nutrition that you can
Yes.
tell us? Yeah.
Yes. Nutrition is very important in elderly people because we have often a situation with undernutrition. Elderly people, they diminish their food intake. They have a problem of swallowing. They have a problem of cooking. Sometimes they are depressed and they don't want to eat. And they have sometimes comorbidities that they have loss of appetite, like when they have, for example, cancers and something like this, or stroke situation, which the elderly people will be enabled. And then when he can't be as he can before, he lost appetite and he can't eat very well, and he lost weight. And when he lost weight, he lost muscles, and he lost muscle, which we call sarcopenia. And when we lost muscle, we have the problem of falling. When he falls, he has other major issue in his health, and it became very difficult to take care, and we have other problems of medical problems will be here.
Yeah, related to nutrition. Yes, of course, we can understand that if they are not well fed, they are going to be weakened. And as you said, they are then exposed to more and more dangerous diseases. So that's why we recommend all families to take care of the nutrition of their elderly, being their parents, grandparents, or whatever. As concerning...
Yes, it's a very important take-home message, to take care of nutrition of elderly people and to verify that they have the food necessary, that they can eat, that they can, because sometimes the situation may be, it's a simple thing. There is some people, they can't eat, they can't take the spoon to their mouth. You know, you must give them nutrition. You must feed them. You know, it's very important to take this to look for this aspect.
Exactly, it's very important. So please try to keep the same place, because sometimes you are having difficulties with the sound.
Yeah,
okay, because now it's clear. We can hear you very well. Concerning your practice, and you as a specialist, you can explain this very well for us, as we notice, we as Tunisian people, as citizens, that there are increasing number of cancer and Alzheimer's among old people. So can you tell us what are the latest approaches to improve the quality of life for these patients?
Yes, I agree with you that Alzheimer's disease and cancers are increasing, and they will continue to rise. For cancers, there are many new approaches. Nowadays, caring for older people with cancer requires specific knowledge, which is referred to as an oncogeriatric care. Now we speak about oncogeriatric care. It's a medical doctor who is specialized in elderly people having with cancers. So chemotherapy, radiotherapy, also surgical treatment must be carefully discussed in committees. The decision to decide that this person could have chemotherapy or can have radiotherapy or can undergo a surgical intervention, it's not a decision of one person, it's a decision of a committee with different intervenants, with different specialty, and then to determine the best decision, because the decision with, like you said, Huda, the quality of life, it's the most important thing we have to the aim of the taking care of elderly people is to have a good quality of life. And if we do treatment and this treatment will have side effects, it's not a good thing. So sometimes we decide not to treat because keeping this person like this is better than giving him medical side effects of chemotherapy or something like this.
Yes, especially at an old age, I suppose it's going to be very difficult.
Yes, and we try to do also screening, very important for breast cancer, for prostate cancer, and for the colon cancer, the most important cancer. And now we spoke also about the lung cancer. So many situations when we can do screening and we have the opportunity, the chance to diagnose the cancer in the beginning, it's better, and we can then we can have the possibility to give the appropriate treatment.
Exactly. And what about Alzheimer's too? I suppose, is there a possibility to avoid Alzheimer or to reduce actually the process of the development of Alzheimer in the elderly?
Unfortunately, no, there is no possibility now to prevent or to reduce. I think the situation is completely the opposite. Alzheimer's disease is going to be more and more. The number of cases are increasing all around the world and here also in Tunisia.
You are not giving good news, you know. You are surprising us.
The problem is that you know about the new...
the new what?
The new treatment, you know, the novel therapy, there is a novel therapy which called target therapy, because now there is no medical treatment. We have symptomatic treatment for behavioral, from psychiatric disorders, to keep the patient good with his comportment, with his behavior in his at home, you know. But there is no radical treatment. Okay.
Yeah.
But you know, now you have a novel treatment which is called targeted therapy, which works through interaction with monoclonal antibodies. And this new treatment, this novel treatment, is reserved for early stage of Alzheimer case. So you must have an Alzheimer and diagnosed it very, very early. Then, when we decide to give this treatment, also it requires close monitoring by doing MRI to detect potential side effects.
Okay.
The problem, there is two problems. First, this treatment is not yet available in Tunisia. And the second problem, another barrier to this medication, it is the cost, because it's very
expensive.
Very costly. Exact. And it is now beyond the reach for most patients. So perhaps the situation will change in the future, and we will have we speak also about human treatment, about vaccine, about there is many, like oncology. Alzheimer's disease is a field that will have many progress in the future.
We hope so. We hope so, because the numbers are increasing in very alarming way. So we are going to end with our last question is, what can you recommend families of patients having Alzheimer's, family of patients having cancer, family of patients who have chronic diseases? And I suppose in one person, a person can have 2 or 3 or 4 diseases. We know that chronic diseases affect elderly. So what would you recommend their families?
My main recommendation for people in generally, that the first recommendation for elderly people. Elderly people over than 60, 65. Now, you know, it's 70-year-old. You can reach even 70-year-old to speak about geriatrician. So I recommend to be well prepared for entering in old age. Prevention is very important in this field. As the French proverb says, it is better to prevent than to cure.
Exactly.
So, prevention is very, very important. Prevention
How
involves
can they
taking
prevent?
care of all aspects of health, all the aspects. For example, such as correcting sensory abnormalities by wearing the proper glasses, the problem of sight and the loss, the problem of the sight and the problem of hearing, treating cataracts, screening for hearing loss. Many people have problem with reducing hearing, so they can't listen well, so they can't speak, or they become depression because the problem of hearing. So screening for hearing loss is very important, using hearing aids. And maintaining, like we said, maintaining good nutrition and physical activity. Our diet, the Mediterranean diet, is very good for our elderly people. So we encourage also physical activity to prevent sarcopenia, to prevent the loss of muscle, which is a real problem in daily practice.
Exactly.
Of course, there is many other examples for prevention: treat well diabetes, hypertension, cardiac problem, stroke, the screening for cancers. Many fields we can prevent and to have the best quality of life, and to enter in the third and the fourth age. Now we speak about the fourth age with good health and with the capacity to take care of ourselves.
Exactly. I mean, the key for living good health, I mean, in a good quality, have a good quality of life, is treating things at the early stages, making early diagnosis, and especially lots of physical activity that is appropriate to their age. With physical activity, they can avoid plenty of things, and also balanced nutrition. It's very important. Yes, thank you so much, Dr. Imen Ksontini, for updating us about what's going on, and we encourage and support this the Tunisian Society of Geriatrics and Gerontology for supporting in and promoting this new specialty, and we hope that you are going to transmit the knowledge and the expertise that you have to future young generation of doctors. Thank you so much for accepting the invitation.
Thank you, Huda, for the opportunity to speak in RTCE, and I hope we have other appointment together.
Opportunities to meet together, yes, hopefully. Thank you so much.
Have a good afternoon.
Thank you. Have a nice day.
Bye-bye. Nice day. Bye-bye.
Bye. We continue with the music.